TMC's Orthopedic and Surgical Tower is where open heart surgery is performed. Valet parking is available outside of the tower. Volunteers are at the concierge desk just as you walk in for any questions you may have. Please take the elevator to the second floor. You'll check in at the desk first and then with a volunteer who will give you a paper that has a unique identifying number on it. Your family and friends who are with you can track your progress using the monitors in the lobby. You will shortly be taken back to pre-op, where a patient care technician will first take your vitals and then ask you to change into a gown. You will have your chest shaved as well as the area from your groin all the way down to your ankles. Patient Gary Shear shares his perspective.
That was a very, simple procedure. They didn't do any nicks or cuts. They were very gentle and very private. And they told me step by step what they were going to do.
You'll be wiped down with antibacterial wipes, asked to change into a different gown, and then you'll be hooked up to an assortment of monitors. The tech will let you know when it's okay for a loved one from the lobby to come back and join you. Your pre-op nurse will then come in to go over any questions you may have. You'll be asked a series of questions and asked to sign some forms. Your nurse will go over your medical history as well as your medication list with you. An IV will be started and your nose will be swabbed with an antibiotic ointment. You'll be hooked up to oxygen, and finally, a pad will be placed on your bottom to help prevent pressure ulcers. An EKG and any other necessary tests may be performed. You'll then meet the other members of your surgical team, including your anesthesiologist, who will likely give you some medicine to help you relax before starting an arterial line. This is like an IV in your wrist that is used to monitor your blood pressure. Your loved one may be asked to step out of the room for this.
They would first tell you ahead of time what they were going to do, and they would show you the device, and then they would tell you how they were going to administer it or do it. And then they would touch rather than just poke in. They would touch and get you, a little more relaxed. And then they completed the procedure.
Your surgeon will also come in, followed by your operating room nurses.
Just before we left the room to be wheeled back to the surgical suite, I was able to say goodbye to my wife, my two daughters, and the rest of my family that was in the room at the time.
As you are wheeled to surgery, we ask those with you to please head back to the lobby.
It was comforting to know that my family could be with me up until a point to where the nurses would ask them that they now had to stay behind as they moved me further towards the surgical suite.
We ask family members who need to step away from the lobby to please do so in the first hour after the patient is wheeled back. Restrooms are conveniently located near the elevator. On the first floor, Higher Grounds, a coffee shop with grab-and-go food items, is next to the concierge desk. Please ask a TMC volunteer for directions to the cafeteria. When the screen indicates surgery has started, please make sure you are seated in the lobby. Most open heart surgeries last 3 to 5 hours. Talk to your surgeon about what to expect with your procedure. A member of the surgical team will occasionally come out to the lobby and update your family on your progress.
They kept them abreast of what was going on. They just did a super all-around job in keeping them abreast, because your family is anxious.
When your surgery is done, the surgeon will talk with your family in one of the consultation rooms located just off the lobby. Afterwards, your loved ones will be instructed on how to get to Rosenstiel lobby right next to the intensive care unit. It's about a 5-minute walk. A TMC volunteer can arrange transportation to the ICU if needed. The operating room team and an ICU nurse will then transport the patient from the operating room directly to the ICU, Unit 480. It will take about an hour for staff to get you settled. Restrooms for your loved ones are conveniently located near the Rosenstiel lobby. The cafeteria is also nearby. Head down the Hall of Giving, then turn right onto Booth Hallway. The cafeteria will be on your left. The nurse will let your family members know when it's okay for 1 or 2 people to come see you inside the ICU. You will likely be asleep and hooked up to many monitors with a breathing tube down your throat, unable to talk.
It is kind of a shock to your family to see you laying there with all of those tubes.
The breathing tube doesn't hurt, but it is uncomfortable. About 4 to 6 hours later, staff will slowly wake you up.
I guess someone talked to me and you kind of come out slow. I didn't have any pain. It was very little pain. I assumed that there would be much more pain than what I experienced. I was groggy, to be expected.
When you wake up, you'll have a catheter in that was inserted in the operating room, as well as a tube in your chest. Your nurse will ask for your assistance in removing your breathing tube. You'll then be put on oxygen. Also, when you wake up, you will likely be cold and very thirsty.
Dry mouth. I was very, very dry. I just wanted water, just needed something to drink.
While your pain will be managed as best as possible, it is expected to be the worst during the first 72 hours. You will be asked to use this scale to communicate your pain level to your nurse.
The staff knows, they're very well trained to keep the pain from setting in. Their job is to keep you as pain-free as possible, and they do a darn good job of that.
The nurse will explain what all of the machines are doing. You will need to use your incentive spirometer 10 times an hour every hour you are awake until you go home.
Yes, it was hard to blow into that device, but if you know and understand that your healing process will proceed much better if you do what they instruct you. It helps your lungs, it helps you heal from inside, and keeps those airways working and open, and will possibly keep you from having some other complications.
You will be encouraged to do breathing and coughing exercises. The day after surgery, you will be given a small pillow to hug.
That pillow is super important.
It allows you to brace your sternum and help manage the pain.
The worst part of the whole procedure was a sneeze. A sneeze, a dreaded sneeze. But that little pillow, whoever invented that really invented something. At first you think it's silly, but boy howdy, let me tell you, it works.
Later that day, you will get up and move from the bed to a chair with assistance.
It was, how do you maneuver with all of this, entanglement of tubes and whatever, but you work through it, and the staff, they've done this hundreds of times before, and they're very good at it.
A few days later, the chest tube, most IV lines, and the catheter will be removed. TMC does have unrestricted visiting hours, but we ask that all visitors are healthy and no visitors sleep inside the patient's room. Patients typically stay in the ICU for 1 to 2 days before being transferred to the post-cardiac care unit, or PCCU, where they'll remain for another 3 to 4 days before being discharged, depending on how they're healing. The nurse will go over instructions for you and your caregiver about what to expect.
They know what to expect. They've been through this. They answer the question before it's asked. They were very conscious of patient care.